Internal medicine, also known as general medicine in Commonwealth nations, is a medical specialty for medical doctors focused on the prevention, diagnosis, and treatment of diseases in adults. Its namesake stems from treatment of diseases of the internal organs. Practitioners of internal medicine are referred to as internists in North America and physicians in Britain and most Commonwealth nations. Internists possess specialized skills in managing patients with undifferentiated or multi-system disease processes. They provide care to both hospitalized, inpatient, and ambulatory, outpatient, patients and often contribute significantly to teaching and research. Internists are qualified doctors who have undergone postgraduate training in internal medicine, and should not be confused with interns, a term commonly used for a medical doctor who has obtained a medical degree but does not yet have a license to practice medicine unsupervised. In the United States and Commonwealth nations, there is often confusion between internal medicine and family medicine, with people mistakenly considering them equivalent. Internists primarily work in hospitals, as their patients are frequently seriously ill or require extensive medical tests. Internists often have subspecialty interests in diseases affecting particular organs or organ systems. The certification process and available subspecialties may vary across different countries. Additionally, internal medicine is recognized as a specialty within clinical pharmacy and veterinary medicine. Role of internal medicine specialists. Internal medicine specialists, also referred to as general internal medicine specialists or general medicine physicians in Commonwealth countries, are specialized doctors trained to manage complex or multi-system disease conditions that single-organ specialists may not be equipped to handle. They are often called upon to address undifferentiated presentations that do not fit neatly within the scope of a single-organ specialty, such as shortness of breath, fatigue, weight loss, chest pain, confusion, or alterations in conscious state. They may manage serious acute illnesses that affect multiple organ systems concurrently within a single patient, as well as the management of multiple chronic diseases in a single patient. While many practitioners of internal medicine choose to subspecialize in specific organ systems, general internal medicine specialists do not necessarily possess any lesser expertise than single-organ specialists. Rather, they are specifically trained to care for patients with multiple simultaneous problems or complex comorbidities. Due to the complexity involved in explaining the treatment of diseases that are not localized to a single organ, there has been some confusion surrounding the meaning of internal medicine and the role of an internist. Although internists may serve as providers of primary care, the term is not synonymous with family doctor, family practitioner or general practitioner, GP. The training of internists is solely focused on adults and does not typically include surgery, obstetrics, or pediatrics. According to the American College of Physicians, internists are defined as doctors who specialize in the prevention, detection, and treatment of illnesses in adults. While there may be some overlap in the patient population served by both internal medicine and family medicine doctors, internists primarily focus on adult care with an emphasis on diagnosis, whereas family medicine incorporates a holistic approach to care for the entire family unit. Internists also receive substantial training in various recognized subspecialties within the field and are experienced in both inpatient and outpatient settings. On the other hand, family doctors receive education covering a wide range of conditions and typically train in an outpatient setting with less exposure to hospital settings. The historical roots of internal medicine can be traced back to the incorporation of scientific principles into medical practice in the 1800s, while family medicine emerged as part of the primary care movement in the 1960s. Education and training. The training and career pathways for internists vary considerably across different countries. Many programs require previous undergraduate education prior to medical school admission. This pre-medical education is typically 4 or 5 years in length. Graduate medical education programs vary in length by country. Medical education programs are tertiary-level courses, undertaken at a medical school attached to a university. In the U.S., medical school consists of 4 years. Hence, gaining a basic medical education may typically take 8 years, depending on jurisdiction and university. Following completion of entry-level training, newly graduated medical practitioners are often required to undertake a period of supervised practice before their licensure, or registration, is granted, typically 1 or 2 years. This period may be referred to as internship, conditional registration, or foundation program. Then, doctors may follow specialty training in internal medicine if they wish, typically being selected to training programs through competition. In North America, this period of postgraduate training is referred to as residency training, followed by an optional fellowship if the internist decides to train in a subspecialty. 23. In most countries, residency training for internal medicine lasts 3 years and centers on secondary and tertiary levels of healthcare, as opposed to primary healthcare. In Commonwealth countries, trainees are often called senior house officers for 4 years after the completion of their medical degree, foundation and core years. After this period, they are able to advance to registrar grade when they undergo a compulsory subspecialty training, including acute internal medicine or a dual subspecialty including internal medicine. This latter stage of training is achieved through competition rather than just by yearly progress as the first years of postgraduate training. Certification. In the U.S., 3 organizations are responsible for the certification of trained internists, i.e., doctors who have completed an accredited residency training program, in terms of their knowledge, skills, and attitudes that are essential for patient care: the American Board of Internal Medicine, the American Osteopathic Board of Internal Medicine and the Board of Certification in Internal Medicine. In the UK, the General Medical Council oversees licensing and certification of internal medicine physicians. The Royal Australasian College of Physicians confers fellowship to internists and subspecialists in Australia. The Medical Council of Canada oversees licensing of internists in Canada. Medical diagnosis and treatment. Medicine is mainly focused on the art of diagnosis and treatment with medication. The diagnostic process involves gathering data, generating one or more diagnostic hypotheses, and iteratively testing these potential diagnoses against dynamic disease profiles to determine the best course of action for the patient. Gathering data. Data may be gathered directly from the patient in medical history taking and physical examination. Previous medical records including laboratory findings, imaging, and clinical notes from other doctors is also an important source of information. However, it is vital to talk to and examine the patient to find out what the patient is currently experiencing to make an accurate diagnosis. Internists often can perform and interpret diagnostic tests like EKGs and ultrasound imaging, point-of-care ultrasound, POCUS. Internists who pursue subspecialties have additional diagnostic tools, including those listed below: cardiology, angioplasty, cardioversion, cardiac ablation, intra-aortic balloon pump, critical care medicine, mechanical ventilation, gastroenterology, endoscopy and ERCP, nephrology, dialysis, pulmonology, bronchoscopy. Other tests are ordered, and patients are also referred to specialists for further evaluation. The effectiveness and efficiency of the specialist referral process is an area of potential improvement. Generating diagnostic hypotheses. Determining which pieces of information are most important to the next phase of the diagnostic process is of vital importance. It is during this stage that clinical bias like anchoring or premature closure may be introduced. Once key findings are determined, they are compared to profiles of possible diseases. These profiles include findings that are typically associated with the disease and are based on the likelihood that someone with the disease has a particular symptom. A list of potential diagnoses is termed the differential diagnosis for the patient and is typically ordered from most likely to least likely, with special attention given to those conditions that have dire consequences for the patient if they were missed. Epidemiology and endemic conditions are also considered in creating and evaluating the list of diagnoses. The list is dynamic and changes as the doctor obtains additional information that makes a condition more, rule in, or less, rule out, likely based on the disease profile. The list is used to determine what information will be acquired next, including which diagnostic test or imaging modality to order. The selection of tests is also based on the doctor's knowledge of the specificity and sensitivity of a particular test. An important part of this process is knowledge of the various ways that a disease can present in a patient. This knowledge is gathered and shared to add to the database of disease profiles used by doctors. This is especially important in rare diseases. Communication is a vital part of the diagnostic process. The internist uses both synchronous and asynchronous communication with other members of the medical care team, including other internists, radiologists, specialists, and laboratory technicians. Tools to evaluate teamwork exist and have been employed in multiple settings. Communication to the patient is also important to ensure there is informed consent and shared decision-making throughout the diagnostic process. Treatment modalities generally include both pharmacological and non-pharmacological, depending on the primary diagnosis. Additional treatment options include referral to specialist care including physical therapy and rehabilitation. Treatment recommendations differ in the acute inpatient and outpatient settings. Continuity of care and long-term follow-up is crucial in successful patient outcomes. Prevention and other services. Aside from diagnosing and treating acute conditions, the internist may also assess disease risk and recommend preventive screening and intervention. Some of the tools available to the internist include genetic evaluation. Internists also routinely provide preoperative medical evaluations including individualized assessment and communication of operative risk. Training the next generation of internists is an important part of the profession. As mentioned above, postgraduate medical education is provided by licensed doctors as part of accredited education programs that are usually affiliated with teaching hospitals. Studies show that there are no differences in patient outcomes in teaching versus non-teaching facilities. Medical research is an important part of most postgraduate education programs, and many licensed doctors continue to be involved in research activities after completing postgraduate training. Ethics. Inherent in any medical profession are legal and ethical considerations. Specific laws vary by jurisdiction and may or may not be congruent with ethical considerations. Thus, a strong ethical foundation is paramount to any medical profession. Medical ethics guidelines in the Western world typically follow four principles including beneficence, non-maleficence, patient autonomy, and justice. These principles underlie the doctor-patient relationship and the obligation to put the welfare and interests of the patient above their own. Doctor-patient relationship. The relationship is built upon the doctor's obligations of competency, respect for the patient, and appropriate referrals while the patient requirements include decision-making and provides or withdraws consent for any treatment plan. Good communication is key to a strong relationship but has ethical considerations as well, including proper use of electronic communication and clear documentation. Treatment and telemedicine. Providing treatment including prescribing medications based on remote information gathering without a proper established relationship is not accepted as good practice with few exceptions. These exceptions include cross-coverage within a practice and certain public health urgent or emergent issues. The ethics of telemedicine including questions on its impact to diagnosis, doctor-patient relationship, and continuity of care have been raised. However, with appropriate use and specific guidelines, risks may be minimized and the benefits including increased access to care may be realized. Financial issues and conflicts of interest. Ethical considerations in financial include accurate billing practices and clearly defined financial relationships. Doctors have both a professional duty and obligation under the justice principle to ensure that patients are provided the same care regardless of status or ability to pay. However, informal co-payment forgiveness may have legal ramifications and the providing professional courtesy may have negatively impact care. Doctors must disclose all possible conflicts of interest including financial relationships, investments, research and referral relationships, and any other instances that may subjugate or give the appearance of subjugating patient care to self-interest. Other topics. Other foundational ethical considerations include privacy, confidentiality, accurate and complete medical records, electronic health records, disclosure and informed decision-making and consent. Electronic health records have been shown to improve patient care but have risks including data breaches and inappropriate and/or unauthorized disclosure of protected health information. Withholding information from a patient is typically seen as unethical and in violation of a patient's right to make informed decisions. However, in situations where a patient has requested not to be informed or to have the information provided to a second party, or in an emergency situation in which the patient does not have decision-making capacity, withholding information may be appropriate. Internal medicine physicians are specialists who apply scientific knowledge and clinical expertise to the diagnosis, treatment, and compassionate care of adults across the spectrum from health to complex illness. Internal medicine physicians, sometimes known as internists or doctors of internal medicine, are experts in complexity. They specialize in adult medicine, and are specially trained to solve diagnostic problems, manage severe long-term illnesses, and help patients with multiple, complex chronic conditions. They provide comprehensive, longitudinal patient care. They have lifelong relationships with adult patients, and their recommendations are based on each patient's unique situation. Internal medicine physicians see the big picture. Their deep training and knowledge of the entire human body and its organ systems give them a unique perspective of how everything works in unison. They analyze, consider, and make connections from multiple data sets, and identify solutions for optimal health outcomes. Internal medicine physicians are known as the doctor's doctor because they are often called upon by other medical professionals for their ability to connect the dots and help solve problems. Their expertise makes them vital to both patients and medical professionals. Internal medicine physicians are specialists who apply scientific knowledge and clinical expertise to the diagnosis, treatment, and compassionate care of adults across the spectrum from health to complex illness. They are especially well trained in the diagnosis of puzzling medical problems, in the ongoing care of chronic illnesses, and in caring for patients with more than one disease. Internal medicine physicians also specialize in health promotion and disease prevention. Internal medicine physicians can be called internists, general internists, and doctors of internal medicine. They are not, however, interns, who are doctors in their first year of residency training. Internal medicine physicians routinely see patients with chronic conditions such as heart disease, hypertension, diabetes, obesity, and pulmonary disease. Often, other medical professionals call upon internal medicine physicians for their ability to connect the dots, help solve problems, and identify solutions. To become an internal medicine physician, a graduate of a 4-year medical school must complete a residency in internal medicine, which usually lasts 3 years. Once general internal medicine residency training is complete, a physician may begin to practice internal medicine, or an internal medicine physician may then choose to subspecialize in a particular area of internal medicine, for example, cardiology or infectious diseases. Subspecialty training, called fellowship, calls for 2 to 3 years of additional training. Most general internal medicine physicians provide care for their patients in an ambulatory setting, office or outpatient, and may also follow their patients when hospitalized, inpatient setting. Other internal medicine physicians are known as hospitalists and care for patients only in the hospital. The term internal medicine comes from the German term innere Medizin, popularized in Germany in the late 19th century to describe physicians who combine the science of the laboratory with the care of patients. Many early 20th century American doctors studied medicine in Germany and brought this medical field to the United States. Thus, the name internal medicine was adopted. Clinical career options for general internal medicine physicians are extremely broad and flexible. 2 of the most recognizable types of practice pursued by general internal medicine physicians are primary care general internal medicine, in which the internal medicine physician cares for patients longitudinally, throughout their health journey and provides preventive, acute, and chronic care, most often in the ambulatory setting, and hospital medicine, hospitalist, in which clinical work is focused on caring for patients requiring hospital-level care. However, it is important to realize that many other practice and career options are available, that none are mutually exclusive. For example, many general internal medicine physicians care for both ambulatory and hospitalized patients, and that it is common for general internal medicine physicians to change their clinical focus or practice setup over the course of their careers. Additionally, a large number of general internal medicine physicians engage in practice that does not fit into the traditional categories of primary care general internal medicine or hospital medicine. For example, some internal medicine physicians build clinical practices in which they work within a multi-specialty practice and provide co-management of patients with complex medical issues, urgent care, or may work in rehabilitation or extended care settings providing ongoing medical care, among many other individualized practice variations. Some internal medicine physicians may also build a focus in women's health, point-of-care ultrasound, POCUS, addiction medicine, or perioperative medicine. Still others may spend a large amount of effort and time in the setting of medical education, such as in medical schools or residency programs. The nature of general internal medicine training does uniquely prepare general internal medicine physicians for academic and administrative activities. Academic general internal medicine physicians are heavily engaged in medical education, both with medical students and internal medicine residents. Research pursued by general internal medicine physicians may include evaluation of treatment interventions, effectiveness of medical care systems, public health, medical education, and patient safety and quality improvement. General internal medicine training also prepares internal medicine physicians well for administrative roles, such as medical directorships, administrative leadership positions including those in hospitals and academic departments, and leadership of medical organizations. During the years spent in a categorical or combined residency training program, trainees work in a variety of settings that may include university hospitals, community teaching hospitals, intensive care units, subspecialty clinics, hospital outpatient clinics, and community-based physician practices. Residents assume progressive responsibility as they acquire various skills in treating hospitalized patients and gain competency in ambulatory care. All residency training in the United States is supervised through the Accreditation Council on Graduate Medical Education. For general internal medicine physicians who are interested in an academic career that includes a research component, a number of academic medical centers also offer general internal medicine fellowships following residency training. Thank you for watching this video.